Okay, hi everybody. Live from the floor here at CES, Neal Batra with you. Another really interesting example, and there's been a running sort of dialogue from the Deloitte Future of Health narrative, which is this notion of technology and this passive technology in in-home devices. And we've been talking about smart toilets for a long time. And so here's another iteration, but what's interesting is the examples we've seen for the last couple shows haven't really made it to market. They made a splash at CES, they haven't really broken through. So I'm here with Hannah, Starling Medical, and it's an interesting, another example of a smart toilet or a smart toilet insert. So Hannah, maybe start with what the product is, what's different about it, why is there a lot of excitement and energy?
Yeah, no, thank you so much. So we're Starling Medical. We've designed an at-home, essentially urinalysis device that sits in your toilet, and we scan your urine every time you go to the bathroom for chronic health conditions. So what's different about Urindex is we actually use optics to scan the urine. So you'll see a lot of times it's more the dipstick technology in the toilet indwelling device. We're using spectral readings to essentially get a pattern for your patient. So what that means is we can see more than just 1 to 3 components. We can see your entire profile. So we like to say that we're essentially getting your spectral fingerprint of your urine.
Yep. Interesting. So what are you starting with right now, and where's the potential to go? Obviously, you're not going to reveal what your development pipeline is. Don't expect you to, but maybe give a sense for what we're starting now, but where this could actually go.
Yeah, so our first product is for urinary tract infection prevention. So we're really pursuing those more complicated health conditions. So that's our first one that's available on the market. We partner with providers. And really the reason for that is because we're targeting more of these acute conditions, we want the patients to be able to get care when they need it. So it's not enough to kind of just say, hey, like you might have an infection, good luck. We're there to be like, hey, we see your trendings. Let's try these behaviors. Let's try making sure you're hydrated, voiding regularly. But if you do have symptoms, we're right there with your provider. We're going to order you a lab. You're going to see them same day, and you're going to get the care you need. And you're not going to that hospital. You're not going to the urgent care.
Got it. So this is going through the reimbursement path. It's covered, and it's focused on seniors right now, correct?
Yeah, so we really, when we partner with providers, it's anyone who's had a UTI in the past 6 months. That happens to be a lot of women and a lot of over 55-year-olds. So we do see it targeting more of that aging population. That happens just as you get older, you're more susceptible to UTIs. And what's really interesting is your symptoms change. So what we're seeing is less pain and urgency, but more actually like delirium.
Right.
So UTIs are very preventable, but if you don't catch them early enough, they can get really serious. So they can result in sepsis. They can actually result in hip fractures, ironically. So we're trying to meet them at home before they even have symptoms, and providing them just with these really easy tools of, hey, it's 2 p.m., have you been drinking water today? And they start to learn these behaviors, and about 90% of our patients stay in this prevention loop where they start learning how their bodies need to react. But the 10% that still get symptoms, they just get their same-day care, and they're not kind of waiting out their symptoms where it could get dangerous.
So then where does this all go? So you're starting with seniors, you're starting with UTI. Do you think you go down market in terms of different market segments, younger market segments? Do you think you expand in terms of the areas you're emphasizing? And do you track maybe complexity avoidance downstream as a way to sort of frame your value prop to the market? Are all those things part of the conversation right now?
Yeah, so like I said, we're scanning your entire urine spectral pattern, so we can see a few other components that we're really interested in pursuing. A lot of them are tied to chronic health conditions, so they do just inherently affect more of the aging population. But for instance, we're really interested in launching a maternal health focused one. So UTIs are extremely dangerous for pregnant women and also preeclampsia. So it could be more of a women's health focus, an aging focus, just the general wellness as well.
Got it. So maybe last question for me. Where are the headwinds here right now? What's hard about this in the current moment? What's the big hurdle that you got to overcome in the coming year or so?
I think meeting consumers in a way that it's not extra effort. So a lot of our engineering was focused on making it seamless. So for instance, our device, it's used 3 to 5 times a day. It's self-cleaning. You don't have to think about it. You're not having, go to your closet and pull out your blood pressure cuff and put it on. We don't want it to be noticeable for the patient or for the provider until there's something actionable.
Got it. So it's that passive embedded tech that maybe is a way forward. It's something we've been talking quite a bit about at Deloitte. Perfect. Hannah, thank you so much for your time. Excited to see what happens here. Smart toilet version 3.0 perhaps, but we're hoping this got some legs this time. Thanks so much. More to come here from the floor at CES.